And the key correct answer is C, failure to develop cell-mediated immunity.
Lots of you selected C, failure to develop cell-mediated immunity. And it was almost as if you wrote this question because so many of you were arriving at that answer naturally and organically. One or two of you may have selected choice D, and I'm curious to hear how you arrived there. And maybe let's hear out loud what your thought process was.
I think for D, when you see in the STEM a patient with HIV, I immediately think about immunosuppression. So that could just be a keyword that, especially if you're crunched for time or something, you see immunosuppression, and then you see leading to decreased serum IgG concentration. And you can think about some of the other problems that could be in the differential that would actually have a decreased serum IgG concentration. So for me, someone might put immunosuppression based on HIV infection and a CD4 count that's 30.
What you are expressing is a thought process that perhaps lots of your colleagues would have as well, and lots of other students taking the exam may go through a similar process of arriving at the answer. If this were a question that I was writing, something very important that I would want students to take away from this is that while advanced HIV especially affects multiple arms of the immune system, the fundamental pathogenesis of HIV has to do with the fact that there is a T cell deficiency. This is really why these hosts are susceptible to fungal infections, to viral infections, to certain opportunistic bacteria like Bartonella henselae, and also to certain types of malignancies. Okay, but also understand though that at profound degrees of T cell suppression, you're also going to suppress other things. They will likely also have a humoral defect. And also, you may see a pancytopenia resulting in then a neutropenia. So in someone who has CD4 T lymphocyte count of 30, you're going to see lots of these defects in a real world setting.